So, in continuation of nuclear pharmacy, so in continuation of that, our today's topic is planning for radiopharmacy. What it requires? It requires following steps, and pharmacists have a paramount role in this. It has a key role of pharmacists. In radiopharmacy, the pharmacists have a key role, important role, for which aspects feasibility of an isotope action, a section, but how to design a feasibility of an isotope section. It can also be called as an isotope section. Radiopharmacy also can be called as an isotope section. Layout and design for a radioactive branch. Allocation of space and equipment for isotopes, laboratories, and information concerning facilities and equipment for isotope programs. Procurement procedures for radioactive materials, radiation, protection measures necessary for their handling, organization and training of the hospital staff for the utilization of radioactive materials, licensure requirements, suggestion for special courses for hospital pharmacists, So, what's the basic requirements for radiopharmacy? First, following are the legal requirements for the establishment of radiopharmacy section hospital. First one is licensures and facilities. First, how to take a license, because everywhere it must be licensed by certain authority, certain controlling authority. So, licensures, radioactives are also potentially dangerous, hazardous. Therefore, their use is subjected to control and supervision of Atomic Energy Commission. So, who control? Atomic Energy Commission Pakistan regulates. It's a federal government agency. Radioisotopes can be used only by duly licensed individuals in premises. In addition, the regulation requires that an institutional license have a medical isotope committee to evaluate all proposals for research, diagnostic, and therapeutic uses of isotopes within the hospital. The basic requirements for radiopharmacy. First is facilities, space, where it has to be established. Nuclear pharmacy must have an adequate space. Radioactive storage and product decay area must be separated from compounding, dispensing, quality assurance, and office area. Equipments, what they need in terms of equipments: isolators or laminar flow hood, fume hood, dose calibrator, refrigerators, they have lead lines, class A prescription handling, gamma scintillation counter, microscope, radiochemical hood or filter system. As you can see, this a good type of a radiopharmacy. You can see in picture how they handling the radiopharmaceuticals in a good established radiopharmacy. So the person who deals with these radiopharmaceuticals, also known as nuclear pharmacist. The person who deals with these radioisotopes or radiation or whatever it is known as nuclear pharmacist. How you can say? A person responsible for formulating and dispensing prescribed radioactive traces and for clinical aspects of radiopharmacy. Radiopharmacists must have trained in following area. Which one of these radiopharmacies? Then he know about elementary aspects of structure of matter, modes of radioactive decay of radionuclide, technology and quality control, applications of radiopharmaceuticals, research methodology. First, instrumentation, principle of radiation detection and detectors, dose calibrators, gamma cell counter, function, quality control of dose calibrator, what are methods, statics and computer science. They know about fundamental concepts, compartmental analysis and mathematical model of physiologic system. Radiation biology and radiation protection, safe handling, formulations, pharmacokinetics, principle of production, in vitro analysis, radioassay, microanalytical techniques. Hiring of nuclear pharmacists is not yet legal in Pakistan, but he must have related qualification when he is dealing with such type of radiopharmaceuticals. There must be a radioisotope committee. It is a board established for supervision and control of hospital isotope program. The committee may include medical physicists, clinical radiologists, hematologists, surgeon. It also suggested that a representative from administration, pharmacy, and nursing service should also be included in the committee. Pharmacists assist in purchasing, receiving, and storage of isotopes. The administrator contribute to the development of entire program. The nurses became familiar with the type of work carried out, the associated dangers and means of protection. Responsibility of committee. What the committee have to do? Radioisotope committee has following responsibilities: review and approval of use of isotopes, special prescribing conditions like training of personnel, disposal method, receive reports from radiation protection officer, review of records, recommend remedial actions, keep record of actions taken in approving the use of isotopes. Now, what's radiopharmaceutical operation? Carried out under supervision of qualified person and approved by Atomic Energy Commission and must follow laws and regulations. Documentation of inventory and disposition is to be labeled with standard radiation symbol, name of radionuclide, chemical forms, amount of radioactive material in curies. Curies. It is, you know, what is curies? Curies. It is a unit of radioactivity corresponding to 3.7 into 10 raised power 10 disintegration per second or becquerel. These are the units of radiations. Curies is mostly that is a unit. Environmental control. The environmental requirements are more critical in radiopharmacy practice because short-lived radiopharmaceuticals have to be administered without conducting quality control tests. Non-terminally sterilized radiopharmaceuticals must be critically controlled to retain sterility till administration. Special purpose built unidirectional airflow cabinets provide aseptic conditions for preparation and handling of radiopharmaceuticals. Ultraviolet light fitted in cabinets offers decontamination. Isolators cabinets used fitted with lead-lined gloves that isolates material under processing from the worker and external environment. Preparation is carried out in a fume cupboard with proper shielding, adequate ventilation temperature at 22 degrees Celsius and humidity less than 80%. The storage of radioactive materials should far away to keep background activity at low level. The role of the pharmacist is that the pharmacist is responsible for ordering, receiving, storage, and keeping the record of all the isotopes in current use, all radioisotopes stored in lead wallet, and a date and time of receipt, purchase order number, name of isotopes and quantity of isotopes received is recorded by radiopharmacist. The radioactivity of wallet is also recorded. Disposal of waste products, perform quality control tests, implementation of good radiopharmaceutical practice, radiation monitoring of radiopharmacy. The implementation of radiation protection and safety policy in radiopharmacy supports research and active participation in research, training to the technologists on the pharmaceutical aspects of nuclear medicine, radiation biology, and protection. So, implementation, radiation protection, and safety policy in radiopharmacy supports research and active participation in research, training the technologists on the pharmaceutical aspects of nuclear medicine, radiation biology, and protection.